In this video, we're going to talk about something that could save your kidneys and your health: chronic kidney disease, CKD. This disease often develops without noticeable symptoms, which means it can silently harm your kidneys for years. But here's the good news: you can take action right now, from the comfort of your home, to spot the early signs of CKD. I'm going to share 5 simple at-home tests that can help you detect CKD before it's too late. These tests are easy to do, and you don't need to wait for a doctor's visit to start protecting your kidneys. Early detection is key, and it can make a huge difference in your health moving forward. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Test number 1. Track your energy and fatigue. Let's start with something that might seem simple but is actually one of the first signs that your kidneys could be struggling: your energy levels. Have you noticed feeling unusually tired, even after a full night's sleep? Or perhaps you find it hard to get through the day without feeling completely drained, even when you've taken rest? This is not just normal aging, it could be a sign that your kidneys are not working as well as they should. Your kidneys play a key role in removing toxins from your body and keeping things balanced. When they're not functioning properly, toxins build up in your blood, and this can leave you feeling exhausted. It's not just that kind of tiredness that a nap or a cup of coffee can fix. It's that deep, unshakable fatigue that sticks with you throughout the day. If this sounds like something you've been dealing with, it's worth paying attention to. Here's a simple test: track your energy levels for a week. Every morning, write down how you're feeling on a scale of 1 to 10. If you're scoring less than 6 for energy on a regular basis, and this pattern persists over several days, it could be a warning sign. Imagine keeping a small journal by your bedside where you jot down your energy level each day. For example, today I felt a 5 out of 10, or I felt a 3 out of 10, barely able to keep my eyes open. This easy method could help you spot any concerning patterns over time. The earlier you notice a problem, the sooner you can act. I had a patient, Anna, a 40-year-old nurse, who noticed her fatigue worsening over a few months. She thought it was just part of her busy job. But when she started tracking her energy, the numbers were consistently low. A blood test confirmed early CKD. Thanks to early detection, she was able to start treatment before it got worse. If you're feeling more tired than usual, don't brush it off. This simple test could be the wake-up call your kidneys need. Keep track of how you feel, and share the results with your doctor for further testing. Remember, your energy levels are a big clue to your kidney health. Test number 2, check for swelling, edema. Let's move on to another important sign to watch for: swelling in your body. Have you noticed that your feet, ankles, hands, or even your face seem puffier than usual, especially after sitting or standing for long periods? Swelling, also known as edema, happens when your kidneys aren't able to remove excess fluid from your body. This can be one of the first signs that something might be wrong with your kidneys. Your kidneys help filter out extra fluid, but if they're not working properly, that fluid can build up, causing swelling. It's often most noticeable in the lower parts of your body, like your ankles or feet. But it can also affect your hands or face. Sometimes, the swelling can be so mild that you don't notice it right away, but if it's left unchecked, it can lead to more serious problems down the line. Here's an easy way to test for this: gently press your finger on your ankle or the top of your foot. If you see a dent that stays for a few seconds, that could be a sign of fluid retention. Try doing this daily, especially after long periods of sitting or standing. Take note of any changes. This simple test can give you a clue that your kidneys might need attention. I remember working with Mark, a 50-year-old teacher, who noticed that his ankles were swelling after long days in the classroom. He started checking daily, and when the swelling didn't go away, he saw his doctor. Turns out, he was in the early stages of CKD, and with the right treatment, he was able to slow its progression. If you see swelling, especially if it doesn't go away, don't ignore it. Use this quick check to see if there's a problem. If it's happening to you, it's time to talk to your doctor. Swelling is an early sign that something could be wrong with your kidneys, and the sooner you address it, the better. Test number 3, observe your urine. Now, let's talk about something that's easy to check but can reveal a lot about your kidney health, your urine. We all go to the bathroom regularly, but have you ever paid attention to the color, clarity, or foaminess of your urine? Changes in your urine could be an early sign of kidney trouble, and noticing these changes can help you catch problems before they worsen. When your kidneys are healthy, your urine should be relatively clear or pale yellow. However, if your kidneys aren't functioning well, you might notice some troubling changes. For example, dark yellow, cloudy, or pink-colored urine could signal dehydration, an infection, or even blood in the urine, both serious signs of kidney issues. If your urine is foamy, it might indicate protein leakage, which can happen when the kidneys are damaged. Healthy kidneys usually keep protein in the body, but when they're not working properly, protein can leak into the urine. Here's how you can check. Take a moment each day to look at your urine. Use a clean container and collect a small sample. Check it in good light for any changes in color or foam. Do this for a week, and see if you notice any patterns. If your urine looks darker than usual or has foam-like bubbles, it's time to take notice. I had a patient named Sarah, a 45-year-old runner, who noticed foam in her urine after intense workouts. At first, she thought it was just from dehydration, but when it continued, she tested regularly and later discovered she had CKD. With the right changes to her diet and medical care, she was able to manage her condition before it became more serious. If your urine looks off, don't wait. A simple observation can help catch kidney problems early. This test takes just a few seconds but could make a huge difference. Pay attention to what your body is telling you. Test number 4, measure your blood pressure. Now, let's talk about blood pressure. Did you know that high blood pressure is both a cause and a symptom of chronic kidney disease, CKD? This is why it's so important to regularly check your blood pressure, especially if you're over 60. High blood pressure can damage the small blood vessels in your kidneys, making it harder for them to filter waste properly. Over time, this can lead to kidney damage and even kidney failure. The good news is that checking your blood pressure is simple, and you can do it from the comfort of your home. To get an accurate reading, all you need is a reliable home blood pressure monitor. A normal blood pressure reading should be below 130/80. If you notice that your readings are consistently higher, especially over 140/90, this could be a red flag. Here's how you can check. Measure your blood pressure twice a day, once in the morning and once in the evening, when you're sitting down and relaxed. Take a few minutes to calm your mind before measuring. Keep track of your readings over time, and if they are consistently high, it's time to take action. If you have a history of high blood pressure, make sure to monitor it more frequently. I worked with a patient named David, a 55-year-old accountant, who noticed his blood pressure creeping up to 140/90. He started checking daily, and when the reading stayed high, he consulted his doctor. The early diagnosis of CKD helped him get started on the right medications and lifestyle changes, which slowed the progression of the disease. If your blood pressure is rising, don't wait for it to get worse. Regularly measuring your blood pressure is one of the simplest and most effective ways to catch CKD early. Taking action now can help prevent serious damage to your kidneys later. Test number 5, monitor your weight for fluid retention. Let's wrap up with one more simple, yet powerful test, monitoring your weight. Many people don't realize that sudden weight gain, even if it's just a pound or 2, could be a sign of fluid retention, a common symptom of kidney problems. When your kidneys aren't functioning properly, they can't get rid of the excess fluid in your body, which can cause you to gain weight quickly. Here's how to test for this. Weigh yourself at the same time every day, preferably in the morning, after you've used the bathroom, and using the same scale each time. Keep track of any sudden weight increases, especially if you notice them alongside other signs of kidney problems like swelling in the feet or ankles. Even a small weight gain can be a clue that your kidneys are struggling to filter out excess fluids. I had a patient named Linda, a 60-year-old retiree, who gained 3 pounds overnight. It seemed small, but she knew something wasn't right. She started weighing herself daily and saw a trend of sudden weight increases. This prompted her to visit her doctor, and early tests confirmed CKD. With the right treatment and fluid management, she was able to keep her kidney function stable. If your weight jumps unexpectedly, don't ignore it. This could be one of the first signs that your kidneys need attention. Daily weighing is a simple, at-home method to track fluid retention and catch kidney problems before they worsen. Test number 6, stay hydrated. Let's talk about something everyone knows is important for overall health, staying hydrated. But did you know that dehydration can also be a silent contributor to kidney problems? Your kidneys rely on a steady flow of water to help filter waste and balance fluids in your body. If you're not drinking enough water, your kidneys can become overworked, which over time can lead to damage. Here's the simple test: track how much water you're drinking each day. The general recommendation is about 8 cups, 64 ounces, of water a day, but this can vary depending on your activity level and the weather. Pay attention to how much water you drink and how you feel throughout the day. If you're constantly thirsty, dry-mouthed, or urinating less frequently, it could mean your body isn't getting enough fluids, and that could strain your kidneys. I had a patient named Carol, a 70-year-old grandmother, who didn't realize how little water she was drinking. After tracking her intake and increasing her water consumption, she noticed she felt better overall, less tired and more energized. But more importantly, she prevented dehydration from adding stress to her kidneys. If you notice signs of dehydration, like dry skin, a dry mouth, or infrequent urination, this is a sign that your kidneys might not be getting the hydration they need. Drink enough water every day to keep your kidneys happy and working at their best. Hydration is one of the simplest ways to keep your kidneys functioning well. Now that you know the 5 simple tests to detect chronic kidney disease early, it's time to take action. These tests, tracking your energy, checking for swelling, observing your urine, measuring your blood pressure, and monitoring your weight, are easy to do at home, and they could make a life-saving difference. Remember, CKD can go unnoticed for years, causing damage to your kidneys before you even feel it. That's why early detection is so important. By paying attention to the signs your body is giving you, you can catch kidney problems early and take steps to slow down the disease. If you notice any of these warning signs, don't wait. Talk to your doctor, get a blood or urine test for confirmation, and take charge of your kidney health. You have the power to protect your kidneys and improve your health. Your kidneys are vital for filtering waste, balancing fluids, and keeping your body running smoothly. But they need your help. By acting early, you can preserve their function and enjoy a healthier life. I've seen so many patients, just like you, who thought they were fine until they discovered CKD in its early stages. By catching it early, they were able to manage it effectively and prevent it from getting worse. You can do the same. So, don't wait for symptoms to become serious. Start these tests today, track your results, and share them with your doctor. Early detection is your best defense against chronic kidney disease. Take control of your health and protect your kidneys, they're counting on you. Thanks for watching. If you found this video helpful, please like, comment, and share it with your friends and family. Your support can help others take action too. Let's stay healthy together.